My name is Polly, and I'm a mental health nurse, specialist in dementia care and end of life. I'm an end of life facilitator, and we are in partnership with Ponea Health to do this video to educate the community on issues that you might, might bug you or you don't know about that we need to get from us. A mental health nurse, a mental health nurse is a nurse who is trained to specifically, in addition to other things, look after a person who is mentally ill. There's a big classification on mental health illness. We are looking at depression, schizophrenia, Parkinson, drug addiction at times, dementia, all those mental health illnesses which affect the brain. Yeah, so the mental health nurse is well equipped to do that. Mental health nurses are usually very courageous. The things that look so hard for families, we are able to break into that and help, especially issues like looking after someone who's suicidal. We can be able to, we know how to de-escalate situations when people are, suicidal or something like that. And apart from the medication, we are able to just, the medication is obviously prescribed by the psychiatric doctor, and the nurses implement what the psychiatric doctors prescribe. If the psychiatric doctors prescribe that this person needs to stay on a one-to-one, that means that they need one person every time around them. If they prescribe that this person needs a lot of engagement, we implement what the psychiatric doctor prescribes. Yeah, the nurses are all specialized in different areas. Yeah. Some nurses go further to do ICU nursing, which is very critical nursing. And I cannot be an ICU nurse. And a general nurse might not do as much as an ICU nurse. All different nurses have got their specialists. Yeah. And we share some of our practices. A lot of things that one nurse knows, another one knows, but one is a specialist. So if like an ICU nurse, there is places where you have wound care nurse, and wound care nurse actually deals with wounds only. We have nurses like pediatric nurses who deals with children. They are so good with children and they know everything about the child. A general nurse might not be as good as a pediatric nurse to look after the baby. And we have oncology nurses. Oncology nurses, very, very important specialism as well. And the oncology nurse is so good in oncology. And the oncology is the cancer patient who needs a lot of that. And this cancer patient might need different specialists of nurses. We all learn from each other and we all educate ourselves on everything else. So all the nurses have got their specialism, but one general thing about nurses is that we are all very caring. Most of us, we're very caring, and we are all very passionate about our job. It's very hard to come across a nurse who is not passionate of their jobs. Yeah, most of us do it. It's if you remember the history of nursing, it's the background is like the Nightingale nurses. It's a calling rather than a job. Yeah, because with a job, the career of a nurse might not pay so much money, but we still love it very much, and we are very passionate about that. That's what we do. So that is the difference between all kind of nurses. All of them are specialists in their own area, but we share one common denominator that we are all sort of, we all have different knowledge, but we could also be, I could be a mental health nurse, but I can dress an wound. I can be able to do other things. So we all share our knowledge with each other. Thank you very much for watching this video and listening to us, giving us time. And you can book our services through ponea.com. There is a whole lot of information there about us.